Hi, this topic is going to cover the an overview of stroke. This is just to enlighten the public, just to know about stroke, because these days you see people coming up with different definitions about stroke. Like I feel the public really needs to know what stroke is about, the types, and how it can be prevented. Because recently I see several patients coming down with stroke, and I know that this thing could have actually been prevented if they actually took certain measures. So just follow me along and enjoy this short presentation. So stroke actually occurs when an artery to the brain becomes blocked or it ruptures. Just like every body part, the eyes, the nose, the heart, the lungs, they are supplied by blood. In the same way too, the brain is supplied by blood vessels too. So think of it like this, that there's a pipe that takes blood to the brain. Now whenever that pipe can either be blocked, probably by a blood clot. A blood clot is like a solidified blood within the vessel. So I said the pipe could actually be blocked by blood clots, or probably thickening due to fat lining the pipe. Or another thing is the pipe will actually burst. So just follow me and see how this overview goes. Now, what are the risk factors? The risk factors for stroke: high lipid levels, that's high cholesterol levels. Actually, when at least the cholesterol levels should be checked. At least when one is around that age of 45 and above, cholesterol levels should be checked. Then even the blood pressure level, you don't need to be old before you start checking your blood pressure. At least check it probably once in 3 months. It won't harm you. Other risk factors: diabetes mellitus, that's elevated blood sugar, and smoking. Yes, there's one that should also be here too, that's alcohol. Yes, I'll write that. Alcohol is also a risk factor. Then atherosclerosis, don't mind that big grammar, it's very easy. Imagine in atherosclerosis, the inner lining the inner lining of the blood vessels has actually been blocked due to fats. So it's just like fats lining the walls of the blood vessels, causing the lumen to be narrowed. Then sedentary lifestyle. Now you see a lot of persons, they love sitting in the chair, they don't like exercising. That is not good at all. Then abdominal obesity too, that's also another risk factor too. Heart disorders. We know the heart is responsible for pumping blood to various organs. So at times, if the heart is not pumping blood properly, it is easy for clots to form within the heart. And a clot formed within the heart stands at risk of being sent to the vessels or the blood vessels supplying the brain, causing a stroke. When we get to the types, you understand what I mean. Then illicit drug using of cocaine and amphetamines. Now recently I've noticed this, that especially among the youth, you see young persons around the age of 30, 40 coming down with stroke. Stroke actually is a disease of the elderly, but now you see them coming down with stroke. Now most of them have actually been linked to the use of illicit drugs, cocaine, amphetamines, and all sorts. Then some other important risk factors are a prior history of stroke, older age, that's age greater than 65, family history, then race, commoner in blacks. Then the epidemiology. Epidemiology is okay, yes. What do we know about stroke? In the United States, is the leading cause of disability, and the fifth leading cause of death in the US. According to the WHO, it says that about 15 million people suffer stroke worldwide each year. And of these 50 million, 5 million of them die, 5 million of them are left permanently disabled. And it is more in men than in women, and it is common in the elderly. However, like I said earlier on, people of around 30, 40, you see them coming down with strokes these days. Now, to the types. Primarily, we have two types: the hemorrhagic and the ischemic. It's very easy, don't mind the grammar. In hemorrhagic, take it as this, like the pipe bursts. If you look at this, you will see that this is the flow, that blood was flowing, and the pipe, that's blood vessel, busted. Now, that is the hemorrhagic, which constitutes about 20% of strokes. Then you see this one, these two. I'll call them the ischemic, but they are the different mechanisms. In the case of this one, you are seeing something here. That's a blood clot. It's like a thickened blood. What happened was in this case, the clot likely formed somewhere, probably in the heart, and was sent. Are you getting me? So that clot being sent blocked this place, causing a blockage here. Now, if you are looking at this, you will notice that in this one, originally fats begin to, like this is a gradual process, fats begin to infiltrate the walls of the blood vessels. They begin to infiltrate the walls of the blood vessels, gradually narrowing. Are you getting me? Now, these fats that are narrowing the blood vessels makes it easy for a blood clot to form at this place. Please get the point. In the first instance, I said the blood clot was formed from a distant site and was sent. But then in this other one, the blood clot was formed at this particular site. So just for you to know, primarily we have hemorrhagic, we constitute about 20%, and ischemic, we constitute about 80%. Now, there is this one which they call the transient ischemic attack. Actually, it resembles that word transient means that the symptoms actually, they're kind of short-lived. They resolve spontaneously. And actually, when a patient has something that looks like a transient ischemic attack, it is like a warning. It is a warning that if not attended to, it can lead to a proper, like a full-blown ischemic stroke. That's why you see some persons that probably while at home, you just couldn't raise one hand, and in minutes or so, they could raise the hand back. What happened was actually a transient. Let me write it out. We give it the short form of TIA, which is transient ischemic attack. So it usually resolves spontaneously. Actually, it's a warning of a greater danger. Clinical presentation. Stroke. The brain actually, different regions in the brain subserves different functions. We have the area controlling the speech, controlling the arm, the movement of the arm, movement of the legs, even coordination, posture, and balance. Different areas subserving different functions, even the movement of the face, swallowing, etc. Whatever you think of. Now, imagine the blood supply to a particular area is affected. It's going to translate in a weakness or paralysis of that particular site. And one thing you know, it is stroke is sudden, not gradual. It is sudden. You see someone now, in the next few minutes, he or she is complaining of weakness in one part of the body. So such a person can complain of weakness or paralysis of one side of the body, probably the hand, the arm, the legs. Some could even complain of loss of sensation, some difficulty with speaking, blurring of vision, some might even lose vision, balance, some might lose coordination. And then in in some forms of stroke, this one is notorious for that, hemorrhagic stroke. Such individual most times present with headache, nausea, vomiting, and at times they tend to lapse into unconsciousness. That's, you see, hemorrhagic stroke actually is more deadly than ischemic stroke, because in hemorrhagic stroke, most of the time when they present, their blood pressure is very high. It's usually very high, and as the blood pressure increases, the bleeding is made worse. So I'm just giving us all these tips so that stroke can be recognized early, and the patient and the relatives can actually take the patient to the hospital, because at times I begin to wonder, a patient will come down with stroke and the relatives will still keep the patient at home, probably force feeding. They'll take the patient to a pharmacist or to a chemist. And there's this thing that people don't know about stroke. Okay, I'll talk more about it when I get to the management. When you notice someone has features suggestive of stroke, immediately take that patient to the hospital. Let the patient seek care immediately. Time is neuron, and the earlier the better, because if you present earlier, some neurons can still be saved and still replace the function of those neurons that were left. That's why it is better to seek care early. Now, how is diagnosis of stroke made? First is the doctor's clinical evaluation. So he evaluates the patient, he checks for weakness, he checks if there are weakness in any part of the body, or if there are any I'll call it focal neurological deficits. What I mean by that is focal are there deficits in any part of the body which is linked to the nervous system. Then another thing which is important is brain imaging. I know you might have heard of CT scan or MRI. So that is very important, because you use that to confirm if it's an ischemic stroke or an hemorrhagic stroke. So that will help you to guide you properly. Then also blood tests too, they are also done to help look out for risk factors such as diabetes, elevated cholesterol levels. Then even cardiovascular tests are done, such as echocardiography, echocardiography, electrocardiogram. All these are just to check the functioning of the heart. Now, how do you manage? This is not for you to treat stroke at home. This is just for you to have an understanding of, what does the management entail. Number one is, stroke is an emergency and it should be treated as such. The moment you notice that this person is having features in keeping with stroke, take the patient immediately to the hospital. Don't say you want to waste time at home to see if they will give drug no, don't do that. Take the patient to the emergency facility immediately. There's actually a particular care. If a patient is brought within 3 to 4.5 hours. Now, if a patient presents within this time, from the onset of the stroke, there's this thing they call thrombolysis. If the patient meets the criteria for it, the patient would actually be thrombolized. Thrombolized just means that breaking down of clots. So if the patient presents within this time period, thrombolysis can still be done with medications. But in my practice, I've not seen any patient presenting within this period. Most of the times, you see them presenting a day after, or you see them presenting weeks after, probably after they've tried all they could. At times, some even present when there are complications already. That's when they present. So it is actually important that patients with stroke present immediately. So they manage. It's actually done by the, so you are not the one to manage. The doctors will do that. So they give medications to break up clots. There's this in I wrote here, intra-arterial thrombolysis. Don't mind the big grammar. What it just means is this: something, okay, a device. Yes, that's the best I can put it. A device such as a, how do I put it? Okay, let me just make it easier for you. Something like a catheter is passed through the arteries from the thigh. They will just find the way it gets to the arteries of the neck, and what it does, it finds a way to remove the clot itself. So I just wanted to have an idea of what the management is like. You don't need to know the details, but at least you have an idea that, okay, just like a pipe is blocked by clots, what can be done to dissolve the clot? Probably a medication can be given to break it up, or probably a catheter. A catheter is like a pipe. It is like they will pass it through an artery in the thigh, and it goes on like that. It goes on like that, passes through the artery of the neck, and from there they know how they do it, and they remove the clots. At times you wonder that somebody that came in paralyzed is leaving immediately with full function of the limbs. Are you getting it? So in some other cases, I mentioned that in one of the causes of stroke, fatty deposits have clogged the lumen of the blood vessels. So surgery could actually be done. To actually remove these fatty deposits. Then another important thing is blood pressure control, and this is very, very, the issue of blood pressure control is something that is dicey. I'll explain what I mean. So though I know you don't need to know much about this, but then mistakes, initially I said we have ischemic and hemorrhagic type. The thing people don't know is they just feel because somebody has stroke, they just crash the blood pressure immediately. You don't just crash blood pressure immediately. First, you need to know which kind of stroke are we dealing with. If you are dealing with a hemorrhagic kind of stroke, you need to reduce that blood pressure. But you don't just crash it like that. We have targets that we work with in the hospital in bringing down the blood pressure, especially for hemorrhagic stroke. Now, the mistake people now make is in a case of ischemic stroke, they crash the blood pressure low. That is dangerous. You don't just reduce the blood pressure anyhow in ischemic stroke. And the reason is, you see, that pressure at which the blood is pumping is actually the pressure sustaining the blood flow to that region. Now imagine you now reduce the blood pressure drastically, you are going to worsen the stroke. And I've seen this mistake people do, that immediately someone has features of stroke, they take the child to the chemist, they take the patient to the chemist, and they give sublingual nifedipine. That is actually dangerous. You see a patient that just has weakness of probably the left arm, now coming down with total weakness of the arm, of the legs. I've seen it before where they took the patient to a pharmacy shop and they crashed the BP. So BP control is very important when it comes to hemorrhagic stroke, because like I said, the pipe has actually busted, like I said. So in hemorrhagic stroke, the pipe, the integrity has been compromised, whereas in the ischemic stroke there is a blockage, but then in hemorrhagic the pipe bursts open. So you need to take note of that, but this is just for your knowledge. I'm not saying you should practice this. Okay, so before I talk about the prevention, still in the management, rehabilitation and physiotherapy is key. After the emergency treatment and resuscitation, it is important patient commences physiotherapy immediately. And the importance of physiotherapy is that neurons that have been lost due to the stroke, there are some neurons surrounding that area that can still take up the function of those neurons that were lost. That is why physiotherapy is important and it should be started early. Then, prevention of stroke. You need to address the risk factors. That's the common ones are the elevated blood pressure, elevated cholesterol levels, diabetes mellitus, that's diabetes, and there are medications to control this. But the thing is, these patients don't adhere with their medications, and sincerely, stroke is preventable. That's the truth. Stroke is preventable. When you give a patient the medication, they feel it's just a one-time drug. That okay, after this quantity is exhausted, they should just stop it. No, I think one thing that people need to know is this: blood pressure medication, the anti-diabetic medications, they should know that they are to continue taking this medication. That's it. They should know this, because when they take their medications, the BP is properly controlled, the blood sugar is properly controlled. And the thing is, I can tell you there are persons who have diabetes and hypertension that don't come down with stroke. And this is because they adhere strictly with their medications. Another thing is regular clinic visit and checkup. Please, if you've been scheduled for a particular time, check in with your doctor, check in with your physician is very important. Also, it will do you, even though you don't have any of these things, it's important to check, just personally check your BP regularly. Probably once in 3 months, once in 6 months. Just check it regularly. To do you no harm. Check yourself. Stroke is actually preventable. That's the truth. But then, due to different lifestyles, you see people coming down with stroke. So please do well to drop your comments. In the comment section below. If you have questions, also drop it. So from time to time, I'm going to be dropping contents such as clinical conditions in the hospital, which I feel the general public should actually know. Even though you don't need to know the intricate details, at least you need to have an idea of what you are being treated for. You need to have an idea of what the condition is. You need to see, sincerely, the first step a patient should know is a proper education of the patient. If you've properly educated a patient and the relatives, sincerely, you have done a good job. So I'll be dropping more interesting contents. Thank you so much.